Brilliance in the operating room doesn't buy character. Dr. Nathaniel Pierce thought his surgical license made him a god, treating ER nurses like disposable servants. He publicly humiliated Abigail Hayes, unaware the quiet woman scrubbing his instruments carried a secret that would soon bring a 4-star military legend to attention. Fluorescent lights buzzed with a harsh, sterile hum over Trauma Bay 1 at Chicago's Memorial Presbyterian Hospital. Friday nights were notoriously brutal, a relentless conveyor belt of shattered glass, twisted metal, and shattered lives. Through it all, Abigail Hayes moved with the fluid, hyper-efficient grace of a ghost. At 36, Abigail was not the loudest nurse in the emergency department, nor the most sociable. She didn't participate in the break room gossip, and she never flirted with the residents. She simply did her job with an icy, flawless precision that intimidated the junior staff and bewildered the senior doctors. Dr. Nathaniel Pierce, however, was not bewildered. He was simply annoyed. Nathaniel Pierce was Memorial's golden boy, an aggressively handsome cardiothoracic surgeon who wore custom-tailored Italian suits beneath his lab coat and drove a midnight blue Porsche 911. He possessed a staggering intellect, hands that never shook, and an ego so massive it possessed its own gravitational pull. To Nathaniel, the hospital was his personal kingdom. The patients were merely puzzles to be solved, and the nursing staff were little more than biological machines designed to fetch his coffee and hand him scalpels. Blood pressure is tanking 85/50 and dropping. Abigail announced, her voice flat and calm, cutting through the chaotic shouting of the trauma bay. On the table lay a 30-year-old male, the victim of a catastrophic motorcycle collision. His chest was a canvas of purple and black, bruising his breathing shallow and rapid. Nathaniel burst through the double doors, snapping gloves onto his pristine hands. He didn't look at Abigail. He rarely made eye contact with anyone lacking an MD after their name. "Massive hemothorax," Nathaniel declared, instantly glancing at the monitor. "He's bleeding out into his chest cavity. Prep a chest tube right side. 36 French. Move." Abigail didn't immediately reach for the chest tube kit. Her eyes remained locked on the patient's jugular veins, which were bulging unnaturally against his neck. She glanced at the monitor, noting the narrowing pulse pressure, then placed a stethoscope precisely over the patient's heart. "Heart sounds are muffled, doctor," Abigail stated quietly. "Jugular venous distension is prominent. Given the steering wheel impact, I suspect cardiac tamponade. We need an ultrasound to confirm fluid in the pericardial sac before we insert a chest tube." Nathaniel stopped dead. The entire trauma bay went deathly silent. Residents exchanged wide-eyed, panicked glances. A nurse questioning Dr. Pierce's diagnosis in front of an audience was professional suicide. "Excuse me." Nathaniel turned slowly, his blue eyes narrowing into slits of pure venom. "Did you just attempt to diagnose my patient, Nurse Hayes?" "I am reporting clinical observations, Dr. Pierce." Abigail replied, her posture perfectly straight, her expression entirely unreadable. "Beck's triad is present. If you place a chest tube while his heart is being crushed by blood in the pericardial sac, he will go into cardiac arrest." Nathaniel took a menacing step forward, invading her personal space. "You are a glorified waitress who hands out bandages and fluffs pillows. I am a board-certified surgeon who trained at Johns Hopkins. You do not think. You do not diagnose. You hand me the 36 French chest tube right now, or I will have your badge deactivated before this shift is over." Abigail held his gaze for 2 agonizing seconds. There was no fear in her eyes, only a profound, pitying exhaustion. Without another word, she turned to the supply cart and retrieved the chest tube kit, sliding it onto the Mayo stand. However, beneath the sterile blue drape, entirely out of Nathaniel's line of sight, she quietly prepped a pericardiocentesis needle, a long, terrifyingly sharp instrument used to drain fluid directly from the sac surrounding the heart. Nathaniel snatched the scalpel and made his incision between the patient's ribs. He violently shoved the thick plastic tube into the chest cavity. Instead of a rush of blood, there was almost nothing. Instantly, the heart monitor shrieked. The harsh, erratic lines of the EKG flatlined. "He's coding," a resident screamed. "V-fib, no asystole, we lost a pulse." Panic erupted. Nathaniel froze. For the first time in his immaculate career, his mind blanked. The chest tube hadn't worked. He had miscalculated. The golden boy was staring down a corpse. Before Nathaniel could even order a defibrillator, Abigail was already in motion. Moving with terrifying speed, she shoved Nathaniel's shoulder hard enough to bump him out of the way. She grabbed the long needle she had prepped, positioned it just below the patient's sternum, and drove it upward, angling it precisely toward the patient's left shoulder. "What the hell are you doing?" Nathaniel roared, reaching to grab her arm. "That's assault. Get away from my patient," pulling the syringe. Abigail ignored him, pulling back on the plunger. Instantly, the syringe filled with dark, non-clotting blood. She had tapped the pericardial sac. As she drained the blood that was suffocating the heart muscle, the monitor let out a sudden rhythmic beep. The flatline disappeared. Normal sinus rhythm returned. The patient's blood pressure began to climb immediately. Abigail stepped back, her hands perfectly steady, and placed the blood-filled syringe on the tray. "Tamponade relieved. Patient is stable for transport to the OR Dr. Pierce." The residents were staring at Abigail with a mixture of absolute awe and sheer terror. She had just saved the patient's life, but she had done it by physically assaulting a star surgeon and performing an advanced physician-level procedure without an order. Nathaniel's face was completely flushed, a dangerous shade of crimson. His chest heaved as he looked from the stabilized patient to the unassuming nurse who had just made him look like a spectacular fool. He didn't feel relief for the patient. He only felt the burning acidic sting of total humiliation. "Get out," Nathaniel whispered, his voice shaking with absolute rage. "Get out of my trauma bay, and don't bother coming back on Monday. I'm going to end your pathetic career." By Tuesday morning, the rumors had mutated into hospital legend. Depending on who was telling the story in the cafeteria, Abigail had either miraculously resurrected a dead man using a ballpoint pen, or she had gone completely insane and stabbed a patient while screaming at an attending. The reality was far more bureaucratic and significantly more punishing. Abigail sat in the plush mahogany-paneled office of Brenda Wallace, the hospital's director of nursing, alongside the chief of surgery. Nathaniel had followed through on his threat. He had filed a massive, exaggerated grievance, claiming Abigail had recklessly endangered a patient's life, assaulted a physician, and demonstrated a catastrophic lack of professional boundaries. Nurse Hayes. Brenda sighed, rubbing her temples. "You performed a pericardiocentesis. That is completely outside your scope of practice. Dr. Pierce is demanding your immediate termination. He's threatening to take his surgical cases to St. Jude's if we don't fire you." The patient was in cardiac arrest due to a misdiagnosed tamponade. Abigail replied evenly, her hands folded neatly in her lap. Dr. Pierce froze. It was a matter of life and limb. The Good Samaritan protocol covers emergency interventions when a physician is incapacitated. Incapacitated. The chief of surgery scoffed loudly. Dr. Pierce is our top earner. He wasn't incapacitated. He was formulating a surgical response. You acted like a rogue cowboy. We can't have nurses playing hero. Despite knowing she was right, Abigail understood the politics of modern medicine. Money talked, and Nathaniel Pierce brought in millions in revenue. A disposable ER nurse, no matter how skilled, would always be the sacrificial lamb. We are placing you on a 60-day unpaid suspension, pending an ethics board review, Brenda said, avoiding Abigail's eyes. When and if you return, you will not be permitted in the ER. You'll be reassigned to the VIP observation wing. Basic vitals charting fetching ice chips. That is the only compromise Dr. Pierce would accept to keep you employed. Abigail didn't cry. She didn't argue. She simply nodded, handed over her security badge for the ER, and walked out. Nathaniel, who had been waiting by the water cooler just to watch her leave, offered a smug, victorious smirk as she passed. She didn't even give him the satisfaction of a glance. Her suspension lasted exactly 2 weeks before the world turned upside down. It was a Thursday afternoon when the hospital was abruptly thrown into a code black lockdown. Sirens wailed outside not from standard ambulances, but from heavily armored black SUVs and military police vehicles. Men in dark suits with earpieces flooded the lobby, securing elevators and blocking exits. General Arthur Montgomery, a 4-star legend, former theater commander, and current member of the Joint Chiefs of Staff, had collapsed during a highly classified security summit at a downtown hotel. Due to Memorial Presbyterian's proximity, he was rushed to their VIP wing. The hospital administration was in absolute chaos. The CEO was sweating through his suit, demanding their best specialists be put on the case. Naturally, Nathaniel Pierce shoved his way to the front of the line, eager to play the savior for a man who had the president's ear. "Clear the floor," Nathaniel barked, strutting into the lavish VIP suite, where the general was being transferred to a bariatric bed. "I want an EKG, a full CBC, a chem panel, and a portable CT right now. Someone get the media liaisons ready. This is a high-profile save." General Montgomery was unconscious, his skin ashen, sweating profusely. His breathing was labored, a ragged, wet sound that echoed in the quiet, heavily guarded room. Reassigned from her suspension early due to the sheer lack of cleared personnel for the VIP wing, Abigail Hayes was the only nurse in the room. Wearing plain blue scrubs, she was standing quietly in the corner, holding the digital charting tablet. Nathaniel didn't even recognize her at first. He was too busy performing for the Secret Service agents and the 2 grim-faced military aides standing guard by the door. "Look at this EKG," Nathaniel announced loudly to the terrified resident trailing behind him. "Massive ST elevations in the anterior leads. Classic myocardial infarction. He's having a massive widowmaker heart attack. Call the cath lab. We are going in for an emergency triple bypass." "Sir," one of the military aides stepped forward, his voice tight. "The general cannot undergo unauthorized surgery without clearance from the Department of Defense medical liaison. It's protocol." "Your protocol is going to kill him," Nathaniel snapped back, using his best authoritative surgeon voice. "I am the chief of cardiothoracic surgery. If I do not open his chest in the next 10 minutes, the United States loses a 4-star general. Move out of my way." As the aides hesitated, intimidated by Nathaniel's sheer arrogance, Abigail stepped closer to the bed. She wasn't looking at the EKG. She was looking at the general's right arm, specifically at a faint, jagged network of pale scars twisting around his bicep and shoulder. Then she looked at his neck, observing the way the muscles twitched with a strange, unnatural rigidity. She checked his temperature, reading it was perfectly normal, which contradicted a severe stress infarction. Abigail knew those scars. She had seen them before. In fact, she had stitched similar ones up in a dust-choked medical tent in Kandahar 12 years ago. "It's not a heart attack," Abigail's voice cut through the room, cool and sharp as a scalpel. Nathaniel whipped around, his jaw dropping as he finally recognized her. "Hayes, what the hell are you doing here? I thought you were suspended." "He doesn't have an infarction." Abigail continued, ignoring Nathaniel completely and stepping directly up to the general's bedside. "Look at the localized muscle fasciculations in his neck and shoulder. Look at the scar tissue. General Montgomery was caught in an IED blast in 2014, wasn't he?" She looked directly at the military aides. The aides stiffened, exchanging a shocked look. "That is classified information, ma'am," one stammered. "He took shrapnel." Abigail said, her eyes rapidly scanning the monitors. "Depleted uranium casing fragments. The primary injury was to his shoulder, but microscopic shards migrated into his bloodstream. It's a known complication of that specific explosive." She turned to Nathaniel, stepping directly in front of the gurney they were about to use to transport the general to the OR. "If you give him heparin and open his chest for a bypass," Abigail warned, her voice dropping to a deadly serious whisper, "the anticoagulants will cause the incised shrapnel near his aortic arch to hemorrhage. You will blow his aorta apart the second you put him on bypass. He will bleed out on your table in 30 seconds. "You are insane!" Nathaniel laughed, a harsh, dismissive sound. "Security, get this deranged woman out of my sight. She's a disgruntled suspended nurse trying to sabotage a surgery." The Secret Service agent stepped forward, but Abigail didn't budge an inch. She locked eyes with Nathaniel. "Order a high-resolution MRI of the aortic arch. 10 minutes. That's all it takes to prove I'm right. I am not wasting 10 minutes on the delusions of a pill-pushing waitress." Nathaniel screamed, totally losing his composure in front of the military brass. "Move the patient." Tension snapped like a frayed steel cable inside the VIP suite. Two Secret Service agents immediately lunged forward, grabbing Abigail by the shoulders to physically drag her away from the bed. She did not scream or fight them. Instead, her body went totally limp, a counter-grappling technique she had learned years ago, making herself incredibly difficult to move while maintaining her unwavering eye contact with the military aides. "Stop right there," a booming voice echoed from the hallway. Colonel Thomas Croft, General Montgomery's chief of staff, pushed through the crowd of terrified hospital administrators. His dress uniform was impeccably sharp, but his eyes were wide with alarm. He had heard the shouting from the corridor. "Release her," Croft commanded the agents. They hesitated for a fraction of a second before stepping back, leaving Abigail standing calmly beside the dying 4-star general. Croft stepped squarely in front of Abigail, his piercing gray eyes scanning her face. "You mentioned the 2014 Kandahar IED blast. That incident and the specific composition of the ordnance used against General Montgomery's convoy is heavily classified. How do you know about depleted uranium casings?" Abigail straightened her posture, her hands resting easily at her sides. "Because I was the senior triage trauma nurse at the Bagram Airfield surgical tent when his convoy was airlifted in Colonel. Former Captain Abigail Hayes, United States Army Medical Command. I spent 12 hours pulling jagged, contaminated metal out of soldiers that day. The general's file noted microscopic shards could not be safely extracted from his upper thoracic cavity. Over time, heavy metal shrapnel can migrate through tissue. Look at his neck spasms. That is heavy metal neurotoxicity mimicking a cardiac event, not a blockage in his arteries. Nathaniel let out a sharp, incredulous bark of laughter. This is completely absurd. She is a disgraced suspended nurse who nearly killed a patient 2 weeks ago, Infernal. I am the chief of cardiothoracic surgery. If we do not transport the general to the OR and push a massive dose of blood thinners immediately, he is going to die under your watch. Croft looked at the monitors, then at Nathaniel's flushed, panicked face, and finally back to Abigail's completely serene, ice-cold expression. In combat, you learn to recognize the difference between arrogant panic and quiet competence. Cancel the bypass, Croft ordered, turning to the hospital CEO, who was practically hyperventilating in the corner. Get this man to an MRI immediately. We are checking for migrating shrapnel. You cannot be serious, Nathaniel shrieked, actually stomping his foot on the sterile floor. You are risking a national security crisis based on the paranoid delusions of a pill pusher. I wash my hands of this. When he dies in that scanner, his blood is on your hands, not mine. Noted, doctor, Croft replied coldly. Move the general, now. 10 agonizing minutes later, the atmosphere inside the hospital's advanced radiology control room was thick enough to choke on. Nathaniel paced like a caged tiger, muttering furiously under his breath about malpractice lawsuits and ending careers. Abigail stood quietly in the back corner, her arms crossed, watching the massive glass window as the general was slid into the humming multi-million-dollar machine. Dr. Simon Gable, the head of radiology, rapidly typed on his keyboard, pulling up the high-resolution imaging of the general's chest cavity and aortic arch. The screen flickered, loading the cross-sectional slices. Suddenly, Gable gasped, leaning so close to the monitor, his nose almost touched the glass. "Dear God," Gable whispered. "What is it?" Croft demanded, stepping behind the radiologist's chair. "Look at this artifacting." Gable pointed a shaking pen at a massive bright starburst pattern, completely obscuring the left side of the aortic arch. "That is not biological tissue. That is metal. A jagged 3mm shard of dense shrapnel has migrated entirely through the muscle wall and is currently resting less than a millimeter from the outer wall of the aorta." The room plunged into an absolutely deafening silence. Every single head slowly turned to look at Nathaniel Pierce. Nathaniel's expensive tan completely vanished, replaced by the sickly translucent pallor of a corpse. His mouth opened, but no sound came out. The god of the operating room was utterly paralyzed. "Dr. Pierce," Abigail said, her voice cutting through the silence like a whip. "What happens to the vascular pressure inside the aorta when you put a patient on a cardiopulmonary bypass machine?" Nathaniel swallowed hard, his hands trembling violently. "It increases. And what would have happened?" Abigail continued, relentlessly stepping out of the shadows. "If you had administered the standard dose of surgical heparin to thin his blood before increasing that pressure. The vessel wall," Nathaniel stammered, unable to meet her eyes. "The vessel wall would have instantly ruptured against the sharp edge of the metal." Gable finished for him, his voice laced with absolute disgust. "The general would have bled to death internally in less than 30 seconds. There is absolutely no surgical intervention on Earth that could have saved him. You would have detonated a bomb inside his chest, Nathaniel. Colonel Croft's face hardened into a mask of pure, unadulterated fury. He turned to the two Secret Service agents standing by the door. "Remove Dr. Pierce from this floor. Confiscate his badge. He is not to come within 500 feet of General Montgomery or his medical charts ever again." "Wait, Colonel, please, I was just following standard cardiac protocol," Nathaniel begged, his arrogant facade shattering into pathetic desperation as the agents grabbed his arms. "The EKG showed—" "Get him out of my sight," Croft growled. As Nathaniel was dragged out of the control room, kicking and protesting, Croft turned to Abigail. The hostility in his eyes vanished, replaced by profound respect. "Captain Hayes, we need an endovascular specialist to retrieve that shard via a catheter without opening his chest. Who do you trust in this hospital?" Abigail didn't hesitate. "Dr. Samuel Bennett. He's the senior vascular attending. He has steady hands, and he doesn't let his ego operate the equipment." "Make the call," Croft instructed the CEO. "And someone get Captain Hayes a proper set of clearance credentials. She's running point on this recovery." Sunlight streamed through the armored glass windows of the VIP recovery suite 2 days later. The atmosphere was completely different now, calm, measured, and heavily guarded. Dr. Samuel Bennett's endovascular retrieval had been a flawless, minimally invasive success. The deadly piece of depleted uranium had been snared and safely removed, and General Montgomery's heart was beating with the steady, strong rhythm of a lifelong soldier. Hospital CEO. Jonathan Davies was currently standing at the foot of the general's bed, sweating profusely through his expensive suit. Beside him stood a thoroughly humbled Nathaniel Pierce. Nathaniel had spent the last 48 hours desperately calling board members trying to spin the narrative, claiming that he had ordered the MRI and managed the diagnostic team. Davies, terrified of losing a wealthy surgeon, had foolishly allowed Nathaniel into the room for the morning debriefing to present a united hospital front. General Montgomery sat propped up against his pillows, reviewing a thick manila folder. Despite the hospital gown, he still radiated the terrifying authority of a man accustomed to commanding entire armies. "So, Mr. Davies," the general rumbled, his voice like gravel grinding under a heavy tire. "Your official report states that Memorial Presbyterian's collaborative diagnostic approach is what caught the anomalous shrapnel in my chest." "Exactly, General." Davies smiled nervously, gesturing to Nathaniel. "Dr. Pierce here is our chief of surgery. He spearheaded the team that secured your rapid diagnosis." Nathaniel puffed out his chest slightly, pasting on his best camera-ready smile. "It was a team effort, sir. We are just honored to have provided you with world-class care." Montgomery slowly lowered the folder. He looked at Nathaniel with the kind of intense predatory stare a hawk gives a field mouse. Then he looked over at Colonel Croft, who was standing by the window. Croft simply shook his head in disgust. "That is fascinating, Doctor," Montgomery said quietly. "Because, according to my Chief of Staff's after-action report, you were roughly 3 seconds away from cracking my sternum open and flooding my system with heparin, an action that would have killed me faster than a sniper's bullet." Nathaniel's fake smile completely melted off his face. "General, I assure you, medical diagnostics are complex. Silence." Montgomery snapped the word, cracking like a rifle shot. Nathaniel flinched visibly, snapping his mouth shut. "I have spent my entire life leading men and women who possess actual courage." The general continued, his eyes boring holes into Nathaniel's soul. I know what a coward looks like. You care about your reflection in the mirror, doctor, not the lives on your table. You didn't save me. A triage nurse saved me. Montgomery turned to Croft. Bring her in. The heavy wooden door opened, and Abigail Hayes walked into the room. She was back in her standard blue ER scrubs, her hair tied back in a simple practical knot. She didn't look nervous, nor did she look smug. She merely possessed the quiet dignity of someone entirely comfortable in her own skin. Nathaniel's face contorted with a mixture of rage and sheer terror as she approached the foot of the bed. General Montgomery looked at Abigail, then glanced down at the file in his lap. Captain Abigail Hayes, 2 tours in Afghanistan, 1 tour in Iraq, recipient of the Silver Star for charging into a burning medical tent to drag 3 wounded Marines to safety during a mortar barrage. Honorable discharge. Yes, sir, Abigail replied softly. Colonel Croft tells me you recognize the heavy metal fasciculations in my neck from the Bagram triage unit, and that you literally put your body between this arrogant fool's scalpel and my chest to stop him. Dr. Pierce was rushing based on incomplete data, sir. I simply advocated for the patient. Montgomery chuckled, a dry, raspy sound. Spoken like a true officer. You don't throw your team under the bus, even when they deserve it. The general pushed himself up, wincing slightly as his core muscles engaged until he was sitting perfectly upright in the hospital bed. He looked directly at Abigail. Slowly, deliberately, the 4-star general raised his right hand and delivered a razor-sharp, flawless military salute. Thank you, Captain Hayes, Montgomery said, his voice thick with genuine emotion. For your service then, and for your courage now. I owe you my life. Abigail's breath hitched slightly, the first display of real emotion she had shown in weeks. She stood at rigid attention and returned the salute with perfect precision. It was an honor, sir, just doing my job. The sheer weight of the moment crushed the remaining arrogance out of the room. A hospital CEO and a millionaire surgeon were utterly irrelevant, reduced to mere spectators watching 2 real warriors acknowledge each other. Montgomery dropped his hand and turned his furious gaze back to Davies. Mr. Davies, I am told this exceptional woman was placed on a 60-day unpaid suspension because she previously saved another patient's life by overriding this incompetent hack, Davies stammered, wiping his forehead with a handkerchief. General, there were protocol breaches. Here is my protocol, Mr. Davies, Montgomery interrupted, leaning forward. By 5 o'clock today, Captain Hayes is to be reinstated with full back pay, entirely cleared of all disciplinary charges, and promoted to head trauma charge nurse of this hospital with a salary commensurate to that title. Davies nodded frantically. Yes, of course, absolutely. Furthermore, the general pointed a thick, scarred finger directly at Nathaniel Pierce. I want this man fired, immediately. If I hear that Nathaniel Pierce is holding a scalpel in this facility by tomorrow morning, I will personally ensure that every single dime of Department of Defense and VA funding this hospital receives is permanently revoked. Do you understand me? Nathaniel gasped, stepping backward as if he had been physically struck. You can't do that. I am a board-certified surgeon. I bring in millions. You are a liability, Montgomery sneered. And you are dismissed. Get out of my room. 2 military police officers immediately stepped into the room, grabbing Nathaniel by the arms. For the first time in his charmed, arrogant life, Nathaniel Pierce had absolutely no power. He was dragged out into the hallway, screaming about his lawyers, his career burning to ashes in front of the entire nursing staff who had gathered to watch the golden boy fall. Abigail watched him go, feeling no malice, only relief. The ER would finally be safe. Captain Hayes. General Montgomery smiled warmly, settling back into his pillows. Pull up a chair. I believe you owe me a story about what really happened in Bagram after my chopper took off. Abigail finally smiled, a genuine bright expression that lit up her entire face. She pulled a chair to the bedside, finally recognized not as a disposable servant, but as the quiet hero she had always been. Titles and expensive suits can command temporary obedience, but true respect is entirely earned in the shadows, where quiet competence speaks louder than roaring arrogance. Abigail didn't need a medical degree to be the smartest person in the room. She just needed the courage to stand her ground. If this story of medical justice and putting a God-complex surgeon in his place made your heart race, smash that like button. Share this video with the unsung heroes in your life, and don't forget to subscribe for more incredible real-life drama stories.